CCG should be part of NHSCC because it's the most powerful body for making sure that clinical commissioning groups are influencing national policy and national guidance.
We are their membership organisation. We're the only organisation that represents CCGs and we provide their independent collective voice.
The information we get on a regular basis from NHSCC is vital to our work as a local CCG.
The benefits are often the things that you don't see. They're the things that informally NHS Clinical Commissioners has been able to influence and to shape behind the scenes.
Clinically led commissioning is different because it means that the GPs who are in touch with patients locally are properly influencing how we spend the bulk of NHS resources and how we make sure that integrated health and social care is built around local communities and local patients.
CCGs are led by local clinicians who are best placed to know what the health challenges are and what the health priorities are for their local population.
Clinically led commissioning is different because you've got clinicians, GPs, nurses, people who work locally in the system really influencing how resources are spent, influencing how services are shaped and influencing what's delivered for patients.
The involvement of clinicians with managers at a senior level keeps the patient need at the centre of what we're trying to achieve.
CCGs need freedoms, they need to be able to act autonomously to make sure that we can develop strong partnerships with our councils, with our providers. We need rules that help us to do that rather than stifling us from doing that. And we just need to have that ability to focus locally on the needs of our populations.
Clinical commissioning is where commissioning actually occurs. It's clinical improvement. And actually, this is the first time I've actually felt it as a commissioner.
To achieve the best results for their populations, CCGs need to understand their populations in detail, but also work collaboratively with other partners in that area.
They need to be engaging, they need to be creative, they need to have a really strong grip and attention to detail.
CCGs are showing that they are really successful in beginning to transform services, and we need to keep with them so they're able to do it more, so that they are much more sustainable and achieve better health outcomes for the population.
Well, the major issues for CCGs in the year ahead are about how we transform the system towards accountable care models.
Making sure that we manage to deliver in line with the resources that CCGs have got at their disposal.
It's pretty tough out in commissioning land at the moment with the financial pressures, and I think it's ever more important that CCGs have got a corporate voice, a collective voice that can push back up through the system, because we can make a difference for our local people by making those things happen.
Our big challenges are twofold. How do we maintain the focus on delivery today and improving services for patients here and now, whilst at the same time planning for the big system changes, the big reconfiguration work, the big transformation agenda around health and care integration over the medium to longer term.
To achieve the best for our populations, CCGs need to collaborate. We need to start working with the entire system, the voluntary sector, social care, public health, NHS England, other CCGs and patients. It's only by working collaboratively that we'll deliver the best system transformation.
We have recently produced a document detailing our key asks for the year ahead. It's really important that we enable CCGs to continue to focus on localism, that we put the environment in place that enables CCG to continue to commission the best possible health care and health outcomes for their local populations.
It's really important that CCGs are part of NHSCC because then we have a strong national voice.
NHSCC has grown to be the collective voice of CCGs. It now has over 91% of CCGs as members. It's a voice to government, a voice to other partners in the health system.